Okay, can you state your full name and what city you're from?
My name is Dr. Vigo B. Olsen, Olsen.
And what branch of medicine did you specialize in?
Well, I always wanted to be an internist, but then I got a sense of calling to go to a distant land. And to do that, I had to be a general surgeon.
And where did you go to medical school to do that?
For regular medical school, I went to the University of Nebraska.
Okay.
For pre-med, I went to Tulane University. It was wartime.
All right, okay.
And it was an officer's training program.
And that was the Korean War? Or?
Yes.
Okay. Yeah.
And then I decided to go forward with surgery. They didn't pay much money to house officers in those days.
Yeah.
And I already had a family. So I was looking, one of the criteria was that we can still eat every day.
Yeah.
There weren't many, but the best one was in Milwaukee, Wisconsin.
Okay.
It is the Milwaukee County General Hospital.
That's funny. It's very similar. When my father, he was what's called an FMG, a foreign medical graduate in the 60s. There were a lot of Korean MDs who got their visas as MDs, and his was in psychiatry. And people think doctors earn a lot of money, but they don't. A resident is basically you barely can eat. And he lived in a cockroach-infested apartment in New York on Long Island. And after 6 months, he couldn't get the English language. My mom was complaining about the cockroaches, but his colleagues encouraged him to stay and finish his residency. And eventually, he ended up in Michigan, and that's where I grew up. I was born in New York. And but anyways, you're basically a Korean War veteran, and thanks to your sacrifices, my father got out of the country. I was able to born here, and in a sense, because I invented this knee regenerative procedure, you're benefiting from the sacrifices you made.
That's exactly
as a Korean War veteran, a medic. And so now you've been having knee pain for how long now?
It goes back about 4 years.
Okay. And then what have you tried prior to our laser and magnet treatments?
Well, I should first say that it was due to I was working in my attic and got in a tight spot, and I ended up having to do a massive hyperflexion movement to get out of the pickle. And so it's a hyperflexion injury, and it damaged the end of the femur, the condyles. They ground into the tibial plateau below that, and it left a great big, the earliest x-rays or the MRIs showed a big clot, a huge clot of blood in the upper tibia. So it was a deranged joint.
Yes, and I could see at that time in 2014 the x-rays that were taken, and we could see, especially in that right knee, you've developed a genu valgus, a knock knee, and it definitely looks like you have, some degeneration, especially in the lateral part of that right knee, all right, which is indicated by right there. Yeah. And so...
Well, there was enough derangement so that now in more recent months and years, my foot has migrated to the right. So...
yes, you have the outward rotation of your hip causing you to walk with the foot outward rotated, which obviously is going to cause some biomechanical issues if we keep like that. And so we had begun your course of the knee regenerative program. We ordered the orthopedic wedges to compensate for the genu valgus, which we filmed before. And you've already feeling the unloading of the lateral part of the knee wearing that. And what was your experience after your first laser and magnet treatment on your knee joint?
The experience was that very first afternoon, The treatment was in the afternoon. Later on in the afternoon, I was not having any pain with walking.
Wow. And your pain before you started the treatment on a scale of 1 to 10 was what approximately?
It wasn't a huge shocking pain,
Mm-hmm.
but it was around a 4 or 5.
And after the first treatment, you walked out of here with a what out of 10?
Mm-hmm. 1 out of 10.
1 out of 10 or 0 out of 10?
That's my guess, but it was not more than that. If anything, it was less than that.
Okay, so that's at least a 75 to perhaps 90% decrease in pain in just one visit.
Mm-hmm.
And you just have a few more to go before you're, hopefully completed with the program. So I'm glad it's working.
I'm glad it's working.
And you're
too.
just living proof, especially, somebody who has training in orthopedic surgery, to understand the mechanism and principles of how we can unload the joint to give it a chance to heal.
Mm-hmm.
Okay? Now what I'm going to do is I'm going to film your ability to get out of the chair, and let's see how you're walking. More strength and stability. Let's see you walk out the door now.
Okay, I can.
And looks like you have better gait, definitely.
That's for sure.
And you feel a lot more stability in that knee.
I do.
All right. All right, doctor, congratulations. I'm glad it's working for you, and we'll continue to strengthen those knees now. Okay?
It's a deal.
All right.